Hospital leaders in Greater Cincinnati are adjusting to the rising number of cases, and they do say that this is the most crucial point since the beginning of the pandemic. WCPO 9 News reporter Josh Bazan explains how doctors are trying to get the public back on board and get the virus under control.
Top doctors at major Cincinnati hospitals say COVID fatigue has some people ignoring crucial safety recommendations, putting the entire region at greater risk. And those doctors say if that doesn't change right now, things can quickly get a whole lot worse.
I know all of us have gotten fatigued.
Real COVID fatigue.
We're not used to doing it. We're used to living life without a mask.
These doctors from several hospitals across Southwest Ohio say people tired of the coronavirus pandemic are at least part of the reason October has brought the largest surge in cases to date for our region.
The entire community respond with what we know works. We know that social distancing, washing your hands, and wearing a mask works.
Addressing the public Friday, health professionals were clear that in Southwest Ohio, the pandemic is at its worst point ever, with record number of cases, hospitalizations, and patients in the ICU.
But we're in a really bad place, and I'm here to share some sobering facts.
This is our generation's World War. In World War II, we lost 290,000 American troops to combat deaths. We're at 220,000 Americans right now to COVID.
The message: now is the time to act before the hospital system gets overwhelmed and before more lives are lost. 2 weeks ago, Southwest Ohio had 114 COVID cases in one day. There were 227 cases Thursday, and health officials say without the public stepping up to prevent the spread, that number could double again in a few weeks.
Everyone must be vigilant. We all want to return to our pre-COVID lives, but we just can't at this time.
These hospital leaders say they're talking about plans to potentially open an emergency field hospital at the Duke Energy Convention Center, but hope the public can help flatten the curve before that becomes necessary. At the UC Health campus, Josh Bazan, WCPO 9 News.